So once we've gotten the patient in the door, now we're an active, ongoing patient. There's something called patient portals that do exactly what my health manager does for Kaiser Permanente. They're very common now. The rush is on. I think the year 2011 will be the year of patient portals. We're seeing a land rush for more practices where they allow patients to go online on one page on their website. It's a window, essentially, into their databases. They are able to look at both the profile, the demographic information of their own information. If they move, they change employers, change health, insurance companies, then they can go in and make those records changes themselves without troubling the office. And in many cases, they're also able to look at their electronic medical records for those practices who have them and for those who have the type of software that will interface with these portals. So now you can go online and see your lab test results. You can see when your next appointment is. You can set up email reminders and so on. So why should physicians do all this? Well, I think in my view, and in the view of quite a few other patients, and even in the view of probably a significant part of the world, healthcare is all about communications, and it's all about that give and take partnership. We understand how rushed doctors are. We see physicians seeing 30 to 50 patients a day. That's a terrible crunch. They really don't have a lot of time for a lot of conversation. It better count when you get your 10 or 15 or 20 minutes in that exam room. Why not do some of that in other ways, in other venues? Why always rely on one-to-one communications between patients and physicians? Why not do one-to-many? Can't some of this information be conveyed through websites, even through email exchanges, secure email exchanges? Why can't we all be just better at communications? Can't we find more efficient ways to communicate? I think the internet has given us every opportunity to do that. Today in medical schools, the big trend is towards what they call relationship-centered healthcare, and communications is an enormous part of that. I think, unfortunately, physicians and healthcare providers can't just focus on the science. They have to focus on the humans, and I think patients are demanding it more and more. So, given that the average doc has about 18 minutes to spend with a patient, according to the CDC, let's make more of the other communication channels out there. Interestingly, I believe it's Bernie Grossman, wrote a book, How Doctors Think. Real interesting insight into the give and take of patient-physician communications. And he cited studies that said the average physician gives a patient about 18 seconds to speak before he interrupts or before he speaks. We can do better than that. And I don't believe that physicians want to do that. I believe they feel the pressure to do that. So there's a brave new world out there for all of us to grasp onto. I have some resources for more reading on this topic on our website, medmarketlink.com/recommended-reading. I'll be adding more to that in the coming days. But I wanted to leave you with what I felt was the most valuable piece of advice my great friend John Jardine gave me. He said, everything's different when you're diagnosed with stage 4 cancer. Suddenly, every day is beautiful and much more meaningful. I live every day like I'm dying. And I wish I'd started years ago. So that's my resolve for the new year, is to live every day like it's your last. Grab all the gusto you can. Carpe diem. And as part of that, let's all be better patients and healthcare providers. Thank you very much. It's been a pleasure speaking to you.